Look, move it towards the TV. No, it's the other, yeah. A little bit more. Okay. Yeah, it's just that. The other is for the Facebook. Okay. She over there. So we are ready to go. Just start with the video, Janet. Hello, everyone. This is another Q&A for the healing cancer in this century. Today we have a special guest, Dr. SVETA or Svetlana Silverman, and she is a breast cancer pathologist. When I interviewed her, there was something that really caught my attention, a very simple concept that still is so deep, and is oxidation stress. Welcome, Sveta.
Thank you very much, Carlos. Thank you for having me.
I want people to understand on the word, what is the work that you do? To understand on the word, what is the work that you do? Because you are a breast cancer pathologist. What does it mean?
Well, basically, I'm a diagnostician, and I diagnose different kinds of diseases, subspecializing in diagnosing breast diseases, predominantly breast cancer. So when somebody has a biopsy or resection of the breast with a lump, I diagnose whether it is cancerous or not cancerous.
And what methods do you use to diagnose that?
Well, I get the slides, so the specimen is processed in a certain way, and little thin sections are put on a glass slides, and I color it or stain, as we say, in a certain way, and then I get it, and I look under the microscope, and I look for certain features. It's called architecture of the cells or the ducts or something like that, and I analyze the quality of the cells, and then I do the diagnosis. And the importance of me as a diagnostician is that upon my diagnosis, the clinicians are going to treat the disease. So I'm the one, basically, I'm the gold standard, whether I'm right or wrong, but I'm the gold standard of the diagnosis. I predict the management of this patient. I basically predict somewhat prognosis of the behavior of this tumor.
Now, so that's a biopsy?
It's a biopsy resection, both of them.
So it's a biopsy. Now, I'm going to ask you, since you do biopsies, have you seen any value on doing thermography?
I have seen people doing thermography, but it's not a scope of my practice. When I get a biopsy, it's usually upon ultrasound guidance, because with the, they stick a needle into lady's breast upon somewhat radiologic guidance. So I haven't seen anyone doing biopsy upon thermography. I just know that thermography is one of the diagnostic modalities, together with a mammography or ultrasound or MRI of the breast.
All right. Now, when I interviewed you a year ago, you were talking about oxidative stress, and that caught my attention very much, because I want you to explain our audience. And before I go on, if anybody wants to the people who are on the phone call, they have to press, what is it, Brian?
5 star.
5 star. Is it here?
It's 5 star.
I don't see. Yeah. If anybody wants to raise their hand on the phone call, on the free conference call, you have to press 5 star. I will see that you want to ask a question, and I will let you ask a question. So could you please explain to our audience, what does it mean, oxidative stress? Because what I see is that you are a clinician, you are a doctor, you talk with the specific the technical words that many of the regular people, we don't understand. So,
oxidative stress. Oxidative stress is relentless, unstoppable barrage of free radicals in our cells. Now, where do these free radicals come from? And we need to understand that we cannot be free radicals free. It's incompatible with life. And it is very normal to have a little bit of pulses of free radicals in our body to our cells because it turns on our immune system. Sometimes we need it as an acute inflammatory response. Having a little bit of free radicals as we gather upon exercise is going to upregulate my heart and on and on. However, as I pointed previously, a relentless, non-stop, chronic barrage of free radicals, which we get from the environment of different modalities, causes what is called oxidative stress, because free radical is also called reactive oxygen species. And that leads to that term which is called barrage, abundance of free radicals or oxidative stress. Why am I so adamant teaching how to take charge and be on top of this oxidative stress reduction? Because oxidative stress leads to the majority of chronic diseases. And if we consider cancer as one of the environmentally induced chronic diseases, it immediately leads me to the point that we need to reduce that oxidative stress.
And now, Christine Price, we are going to answer your question very soon. Thank you for your question. I want to finish the subject of oxidative stress. So, Christine, Dr. Silverman, we answer your question soon. Now, where oxidative stress comes from? In my mind, any kind of stress will cause oxidative stress. So, oxidative stress is the name, let's say, chemical name of what you see in our body that is caused by external stimuli. So, I heard that the doctors, any doctor knows that stress is a silent killer. Because what is accumulating these free radicals? So tell a little bit about that. Where the oxidative stress in our body comes from?
Thank you very much for this question. Let's build a chain.
Yeah.
Stress. And stress we feel, and sometimes we don't feel. So it's called environmental stress, whether it is pollutions, whether it's toxins, whether it's bad food, whether it's emotional, financial, job-related stress, or very invisible stress that we get from these things. And sometimes we don't feel. That stress gets into our cells. So the stress that our cells feel, that barrage of free radicals, is called oxidative stress. So, and that oxidative stress is a culprit, is the root cause of the chronic diseases or chronic inflammation.
There we go. And she said a word that I love, is the root cause. Because after working for 23 years in an integrated cancer treatment where we hit the tumor to destroy the tumor because it doesn't like the heat, I was interviewing especially women with breast cancer or ovarian cancer, and they told me without me even asking of the stress caused in their life by a marriage, a breakup, a son that died. So all that stress produced this oxidative stress, and little by little is making us sick from the inside out. So she said that the root cause, and this is the reason of this online video summit, my online video summit. I don't talk about all the different kinds of treatment because you can hear that from the truth about cancer. I go deeper. I go to the root cause that comes from the stress of financial stress, of a toxic relationship, or a dog or a cat that dies, and everything that accumulates. And if we don't have the capacity to process that in a healthy way, I just, let me tell you an example. A friend of mine, her son is breaking up with her girlfriend, and the guy, young guy, wants to die. because the stress that he has in his body is out of control. And people, as you said, they don't pay attention to that. So anyway, anything else you would like to add about this, where the root cause is oxidative stress comes from?
Well, the thing is, if we start analyzing the root cause, as you said, oxidative stress in the cells is basically changing what I call is biophysics of the cells, or biophysiology, or electrophysiology of the cells. Is going to imply on every either physical or physiologic pathways in the cells. And that is going to impact on the ability of the cell to repel that free radical damage. And when the ability to repel that free radical damage fails, that's when defense fails, and that's when we start developing endless myriad of chronicity, including depression, including cancer.
Oh my goodness.
Oxidative stress leads is, if you go on what is called PubMed or the National Institute of Health digital database or digital library, and you just simply type oxidative stress and depression, you see how many hundreds of hits you're going to get. Absolutely, there's oxidative stress. If you start typing oxidative stress diabetes, oxidative stress cancer, oxidative stress Parkinson's disease, that's when you start seeing the links. Why am I so adamant about reduction? Because when the cellular defense fails to repel that free radical barrage, it leads to chronicity. We, as physicians, we know how to deal with acute processes. We fail to deal with chronicity. Oxidative stress is a root cause of multiple sclerosis.
Well, you just said something that really shocked me, knocked me off, because you mentioned stress. And then I put the connection, how when we let the oxidative stress, the stress of life take over us, we develop depression. And I was just thinking of this celebrity suicidal epidemic, that the common denominator is depression. This is really incredible.
And the thing is, from that perspective, as a physician, as this kind of physician, I teach all the modalities to reduce that oxidative stress. It has to be good foods. It has to be happy mind, of course. It has to be good water. It has to be meditation, praying, and then you need to go and upregulate yourself. So, for example, very sadly, we just heard of 2 suicides, one by Kate Spade and another one by Anthony Bourdain. And I'm pretty sure that Kate Spade has a personal chef. And I'm pretty sure that she had the best food on her table the money can buy. However, the cells were still dirty. It was not enough. The cells were not able to combat that cellular stress, which eventually tipped it over, and she,
Yeah, commit suicide. So, Christine Price, I will answer your question. You said, "Hi, Carlos. I had this scar, and the oncologist thought I have DCIS. Any advice? I have mammograms, and following a mammogram, had an ultrasound, and was told that I may have DCIS, not follow-up offer." So this woman has a scar, and they said she might have DCIS. Is there any way to rule this out without going through treatment?
Well, before to go into any treatment, it has to be morphologically or pathologically diagnosed as DCIS, which stands for ductal carcinoma in situ, meaning it's a carcinoma, but it's confined carcinoma. It's a carcinoma in the envelope, but at this stage of the game does not have ability to penetrate into the rest of the breast or that ductal carcinoma in situ is that type of a cancer that does not have the potential to spread. And it has to be diagnosed. Again, here comes us, breast pathologists, to diagnose. We cannot speculate, or radiologists cannot speculate whether there is or there is not. The only person who is going to unequivocally say yes or not is going to be a pathologist, meaning that the biopsy.
Christine, I will give you my knowledge regarding this. This is out a little bit of this conversation. However, what I learned is that you can try a thermography and see if that scar is harder than the rest of the tissue. You had the mammogram, but did you have a biopsy? Maybe the biopsy will rule this out. However, you can take the approach to take a thermography, and if the temperature is not higher than the healthy tissue, maybe it's not. That's my 5 cents advice. I will ask another question. Let me see if there is anybody in the free conference call. No. All right. I have 4 questions, but you answered them all. You were talking the protein and NRF2 protein important in protecting our health. Can you explain a little bit what is that protein NRF2 and how does it help us?
NRF2 is our master regulator of health. It's our sort of, a master sensor of a cellular problem and stuff, or other words, you can put it, it's a thermostat. It's a cellular thermostat, a cellular rheostat that senses the cell need help. So, and then this NRF2 protein, which is a protein complex actually, it stands for nuclear erythroid factor 2. And when it is upregulated or it senses the stress, it becomes free. When there is no cellular stress, it sits in hiding. It sits what is called bound or tied up like a collar and a key, like this, like a cup, like so. Mm-hmm. So when there's some sort of a cellular stress or cellular insult, so that part, which is NRF2, gets free, and it goes into the nucleus, into the core of the cell, and it starts activating what is called survivor genes. And those genes are divided into 3 categories. One is going to be antioxidant genes. So the antioxidants that we make to protect our cells and clean ourselves from the cellular garbage, which is again is suppressed when there's too many free radicals. The second category of these survivor genes are anti-inflammatory genes against the chronic inflammation. And the third category of those genes is the anti-cancer genes. So the genes that turn off the cancers, because we have pro-cancer genes and anti-cancer genes. So that is why the importance of NRF2 protein for regulation. The problem is when we have this oxidative stress, that NRF2 is not functioning properly. It is overwhelmed. It is basically there, but it is suppressed. So you need to turn it back to normality. There are different ways how to do it, but it has to be upregulated.
Right. So, do people have a way to bring that protein, extra protein, if they don't have enough?
Absolutely. In a sense, the concentration of this protein starts decreasing with aging.
Oh.
After 20 years of age, as a normal evolution of the cells, senescence, it's called cellular senescence, of cells getting older, the production and the concentration of this NRF2 protein decreases. So you need to take care of it. You need to prevent. You need to be very proactive. You need to be pro-health. You need to anticipate the events, meaning that you need to optimize your foods, absolutely nutrient-dense foods, and you need to add this NRF to supplementation.
All right. If somebody really takes care of the nutrition, exercise, and meditate, do you think it's a better chance to have enough of that protein?
No.
No, no.
No, not enough, not enough. That is what I call essential supplementation. You absolutely must eat right, eat your nutrient-dense foods. You absolutely must exercise. You absolutely must drink healthy water. And it is still not enough because you are aging. Whatever you said before is not going to decrease that senescence. Upregulating NRF2 will because you're boosting your antioxidants to begin with. You're boosting what is called glutathione. Glutathione is the master antioxidant in the cells, which is critically important. So you can eat right and stuff, and then in the middle of the day, you catch yourself, I need a nap, or I have a brain fog and stuff. It tells me immediately you need your glutathione. So in order to bring them, you know that your NRF2 is not upregulated properly.
Okay, we have a question in Facebook that I want to read it to you. Let me see. What is the question? Christine Price. That's the question, Janet. I had to cease with develop and had them lanced. Is that the question, Janet? That's the question? Jeff, I don't see it. Let me see. Where is it? I don't see it, Janet. Can you just read it to me? I don't see it. Do you see it, Jeff? I don't see the question, Janet. Hold on a second, everybody. I'm trying to find the question. While I find it. But I don't see it here. It should be at the end, right? At the top. No, I don't have it. Anyway. So you said that that's not enough, and the glutathione has that protein. And how do we know if we are really lacking on that protein? Is there a test?
It's very, very simple. Assess your energy level.
Oh, that's very interesting. This is easy.
Very simple. It's like, how you feel? Assess your energy level. How's your gut function? Do you have a leaky gut? If you have a leaky gut, you have oxidative stress.
Yeah.
If you have oxidative stress, it's that chain. You don't have enough glutathione.
All right. That's a very good way. I'm sorry. Do you see the question, Janet? I don't see it. Yes?
Is lancing sufficient to stress and nursing?
But I need to read it here because I cannot hear. Yeah? But I have nothing here in the top in my.
Is lancing sufficient?
Hold on a second. I cannot hear. Is it in Facebook or in YouTube? What is the name of the person?
Christine.
Ah, Christine. Oh, yeah. But is it the one that I just read? I had to cease to develop and had them lanced? Is that the question?
No. Is lancing sufficient to stress and nursing?
Ah, here we go. Christine asked, is lancing sufficient? I don't know what is lancing. The stress
Cleansing.
is what?
Cleansing.
What is that?
Cleansing.
Ah, cleansing.
Lancing.
Lancing, she says lancing. I think she means cleansing. Sufficient, Christine, I don't know if you mean cleansing. Sufficient. The stress of nursing my dying husband was huge, but done with love. Well, what can you tell? Stress is a stress.
That's the whole thing. people who grieve, that grieve stress, it's a huge stress. That's a saying. It's going to lead to oxidative stress.
Yeah, and she says next, energy very poor, because answering what you just said.
Absolutely. I have in my mind to deal with oxidative stress and cellular health. I usually teach 3 components. I teach oxidative stress reduction by anaerobic activation, then adding mitochondrial upregulation. That's your power factory, and then definitely boosting your blood, boosting your microbiome.
What I want to add, Christine, is this. I know what does it feel and how debilitating, how much energy it takes of somebody who is down. And you said, down with love. This is the only way. I'm going to give you an extreme example. Mother Teresa of Calcutta, she did that job that was really, really tough because she had an incredible amount of love. If I can suggest you something, this is the only thing. What you are doing is great, but you need to take your love to the extreme, to do it with joy. I know that it's difficult. Try to practice meditation, but you need to bring something from inside. That lack of energy, everything will have to come from the inside. And I know it's tough, Christine. I am telling you.
You need to turn it into positivity.
Yeah.
That love that you have for someone you care, you need to try to turn it into positivity. You're helping them to find their way to go or to cope with the disease, and you're doing the very best. And at the very least, you can love yourself, and that may lessen that stress. But especially in a situation of very, very high stress, you need to have that oxidative stress reduction supplementation. You need to find those supplements that are going to reduce that cellular stress. Yes. That's must.
This is a best case. I mean, it's the best case to apply what Dr. Silverman just said. Get that supplementation besides everything else that you are doing. Another thing is, as she just said, you are doing your best, and you need to know that. I recommend you to read the book Letting Go. Letting Go means letting go of these toxic emotions that you have, and try to work, even though it may feel for some of you that it's not compassionate, this is an opportunity that God is giving you to do a big effort in life, because otherwise there is no other explanation. Thank you for sharing this, Christine.
Thank you very much.
Yeah. All right. Unfortunately, Sveta, you are so good at explaining this that you answer all the questions. I don't have anything else.
The more questions are going to come up, I'm always available to have another Zoom with you.
The other thing that caught my attention very much, and I didn't put the things together, when Dr. Silverman was talking about when we have this oxidative stress, we develop depression and many other things. It's something that most people are not aware, but it's very true. It's like these chemicals start controlling our moods and our energy, and if we are lack of energy, we may develop depression, and that could go deeper and worse. So it's very important to keep the oxidative stress at bay and do something. So, how is the name of that supplement? Gluta?
No. I do not have. It's an antioxidant, glutathione.
Glutathione.
The supplement you need to make your own, because a lot of glutathione pills do not work. It's not bioavailable and bioabsorbable. You need to make your own. You need to turn on the glutathione genes.
Okay.
So that is why you need to start on an NRF to boost on an NRF activator.
Right. We are just half an hour, and I don't have any more questions. And one of the reasons I believe is that this is a very specific subject that many people are not aware. When we did the first Q&A with thermography, we have very little question. With the second, we have more, and with the third, we have more. Maybe when we do 3 Q&As with you, people will have more questions because they understand the importance of this. While I wait for other questions, I would like to do a summary from what I understand. Oh, I have a question here. We have a question, the phone number that ends with 6034. Let me connect. Okay, let me put the volume to the maximum. Go ahead, what is your name?
Yes, I want to know what is the role of, well, I have 2 questions actually. The first one is, what is the role of direct as opposed to indirect antioxidants? That's my first question. And the second question is, if oxidative stress is so bad for the body, why do some people use ozone treatments for cancer? Because ozone causes a lot of oxidation reactions.
Awesome, thank you. Awesome questions. So the difference between direct antioxidation and indirect antioxidation is direct antioxidants. So let's say your vitamin C, your vitamin E, your vitamin A, when you eat it, then it immediately mediates directly with a free radical. However, it works on one-to-one basis. It's like one molecule of vitamin C is going to eradicate one free radical. Indirect antioxidation is what you make. It is what exactly I was explaining. There are genes that stimulate our cells to make our own antioxidants. For example, already mentioned one, glutathione. The others to be mentioned are, for example, superoxide dismutase, catalase, hemaoxygenase, sirtuins, and many, many others. And the difference between eating antioxidants and making antioxidants, our own, for example, superoxide dismutase, has a capability of eradicating over 1 million free radicals per second every second. That is why when people say, I eat enough, no, that is not enough, because 1-to-1 is not equal to 1 per 1 million. However, you need both, because there's a beautiful interplay between direct antioxidation and indirect antioxidation. Vitamin C is not going to be recovered without glutathione, but glutathione also needs vitamin C. So there's a beautiful, beautiful interaction and interplay. In terms of, so reduce your oxidative stress, definitely, the reduction of oxidative stress is more important into cancer prevention. Now, why conventional medicine, medical oncology does not prescribe, for example, antioxidants during conventional chemotherapy? Because conventional chemotherapy is actually based on free radicals. So those abundant free radicals is going to destroy those those tumor cells. We also need to remember that with destroying tumor cells, the chemotherapy is going to destroy the normal cells. So the whole idea is, why don't we prevent before we need to deal with this?
Mm-hmm. Well, I hope that answered your question. What was your name again?
Meta?
I'm sorry, Neda?
Yes.
Okay, I am just going to put it here. Do you have any other question, Neda, or did I answer
My
your...
second question was on the, if oxidative stress is really bad for us, then why are sometimes ozone treatments used for cancer? How does that work?
Because we don't have any better for now.
Well, in conventional medicine, we don't have any better. That's why
Well, we need to prevent. That's why exactly we need to take charge of our lives and eat direct antioxidants and reboot our ability to make our own antioxidants, reinforce our own antioxidation with good water and exercise and healthy mind, be proactive with our health.
Neda, this is my opinion, on my personal opinion, and what my online video summit supports, and is this. Chemotherapy was created about 60 years ago because we didn't know any better. Since then, the knowledge of human beings have changed, and now we know that chemotherapy is very destructive. There are occasions and chemotherapy works well. And there is also tests that usually are done in Europe, in Italy, where there is a targeted chemotherapy and you have a specific, not all chemotherapies works with everyone. However, in the last 30, 40 years, people start knowing that nutrition helps or makes the body sick, that there are other forms of alternative treatments. There are many, many, many. I worked for 23 years, so I know most of them. Many of them cannot be practiced here in America because they are not FDA approved. You can go to Mexico, you can go to Europe. However, the FDA have approved hyperthermia in combination with radiation, and hyperthermia is just hitting the tumor. I work in a clinic where we did hyperthermia. So this is the reason why chemotherapy is still used. However, there are many alternatives, and I agree 100% with Dr. Silverman just said, is a million times more important prevention. Prevention, because when you get to the stage that the breast has a cancer, well, unless the person is very strong and had a firm conviction with the chemotherapy, they will rush this person to a lumpectomy or mastectomy, which I totally disagree with that. And then followed by chemotherapy and radiation. So that's the reason, answering your question.
Yes,
why?
but I think you misunderstood my question. My question was not about chemotherapy. It was about ozone, which is considered alternative. It is considered not FDA approved, but it is also causing oxidation. So oxidation seems like it's used even with the alternative treatments for cancer. Plus, the mitochondria themselves are also using oxidation to produce energy. So in a way, you could say that oxidation is good in a certain sense. So is there a way to balance oxidation with antioxidation by taking antioxidants? Because it seems like if you don't have oxidation reaction in the mitochondria, you wouldn't have energy either, right?
You're absolutely correct. That's exactly how I started. You need your free radicals to turn on your antioxidation mechanisms, absolutely, and mitochondria, and so on and so forth. And that is exactly what we're teaching. You need to find healthy cells are going to find a way to balance oxidation versus antioxidation.
Yeah, okay. Now I understand your question. It's a natural process in the body and produce oxidation, but this is normal. What we were talking at the beginning is when there is over free radicals. There are much more that our body can handle. So did it answer your question, Eda? Okay. Thank you so much for this question. Do you have any other? Because we need more questions.
No.
All right.
And then you obviously can Facebook or private message on Carla's Facebook, and I will reply.
All right. Thank you so much, Neda.
I would like to chat more on this.
Okay. I will mute you, Neda, but if you have any other questions, just raise your hand again. All right. Thank you. I just want to mention, we are just in less than 40 minutes. The reason of doing this online video summit is to educate people about things that you don't learn anywhere. Like, for example, Dr. Silverman talks about these important things that she sees every day in her practice diagnosing breast cancer. And even though she works doing, I forgot, the biopsies, which is part of the conventional treatment, she knows the root cause of oxidation, that is the stress in our bodies. And
see, Carlos, you just forgot, so you need to go to the time.
No. What happened? There was a ring. but I came back right away. And the main message that I want to bring people is we need to find the root cause of any kind of health condition, whether it's lack of energy in our body. I remember that a month ago, all of a sudden I start feeling really weak and my levels of energy, they are always high. And I didn't know. I feel silly telling you the reason was that I was going to sleep late. And I always tell people go to sleep early because the body has to regenerate. And we were talking about self-love. Yesterday I was in the freeway and there was a big sign that said, sleeping is self-love. So if you want to reduce your stress and maybe reduce or eliminate the chronic fatigue, go to sleep early. So you wake up early, but the body needs to regenerate. SVETA, I read somewhere in the internet, sleep is for weak people. What do you say when we don't sleep enough? What happens with our body?
Well, oxidative stress happens.
There you go. So we need the sleep time that we need. It's not just because we are sleepy.
But when you start reducing your oxidative stress, you will not need that extended amount of sleep. Your actually need for sleep is going to decrease, and your quality of sleep is going to improve.
Yeah. So what we have to do is to have the regular hours of sleep instead of being in Facebook until 2 in the morning or watching YouTube videos. I have clients that when I ask them, they tell me I feel weak, I feel depressed. What do you do? What time do you go to sleep at night? I between 1 and 2. What do you do? I watch videos in YouTube. I am in Facebook. Well, that is a big source of oxidative stress because we don't let our body to heal ourselves. All right, let me see if we have any other question anywhere. Since we don't have any other question so far, I am surprised that we don't have any questions in YouTube. People in YouTube, please, Janet, can you type in YouTube, please ask your questions here? Because there are a lot of people in YouTube and I don't see any question. Any question? The subject today is about breast cancer pathology. Dr. Silverman diagnosis through seeing in the microscope a biopsy, which is taking a little piece of tissue, a little piece, yes, of tissue on the area that is supposed to be abnormal. And the most important thing in this Q&A for me is that she mentioned at the beginning, we need to find the root cause of this oxidative stress. When it's too much, we have too much free radicals and that affects our health. I don't see any other question. And if we don't have any other question, we can
We'll say goodbye.
say goodbye.
Janet has a question.
In where?
She has a question.
You, so go ahead, Janet. Would you like to come here? Okay, just say the question.
Does stress affect soft cysts or hard cysts, or soft tumors or hard tumors? Is there a difference?
Janet asked if,
Stress reduction.
I'm sorry, if oxidation affects soft tumors and hard tumors.
The same.
The same. If oxidation affects soft tumors or hard tumors in the same way or not?
Well, I don't particularly understand the question. Oxidative stress causes all kinds of tumors, whether they're soft tumors or solid tumors. Now, the treatment is a different story, so I didn't particularly catch the question.
Reducing stress would that help more with soft tumors or hard tumors?
What if reducing stress will help our
Tumors to degenerate?
No. If we reduce stress, it will help in fighting soft tumors or hard tumors.
Absolutely. Any kind of tumors.
Any kind of tumor.
Any kind of tumors, because you're boosting your immune system.
Oh, that's another very important phrase. When we reduce stress, improves our immune system.
You boost every cell. So whether it's an immune system, whether it's a liver cell, absolutely, your cells start functioning better.
Fantastic.
Because, yeah.
Sveta, I think your answers are so precise, everybody's speechless. There is no more questions. And I found this because you are very, your answers are very complete and precise. Everybody in the free conference call, if anybody has a question, this is your opportunity. In Facebook, not many people. However, if you have any question, this is the last opportunity. And please, people in Facebook, please share. And YouTube, we don't have any more questions. Thank you so much. That was very enlightening.
I wish you happy 4th of July. We just came from Canada Day. So I wish you all the best. I wish you health.
Yeah.
I love. Please answer. Please send me the questions. If you want to go on my Facebook, absolutely. Private message me, even without being my friend.
I want to mention something. I went to the beach yesterday. People are in preparation for 4th of July. And there was an airplane with a big banner behind this flag doing advertisement. And they were advertising an alcoholic beverage that says Americans' favorite. What does alcohol do in our body? It increases the oxidation or reduces it?
It depends on what type of an alcohol you're doing and how much. For example, red wine has an ingredient, it has an extract, an ingredient which is called resveratrol. And resveratrol is NRF2 activator as well as a direct antioxidant. However, if you're consuming it in way too many quantities, that basically defeats the purpose, as well as let's say whiskey. Or I'm not versed into alcoholic beverages. That is not good. So dry wines, we have a point that some consumption of dry wines, whether it's red wine or white wine, due to resveratrol and some other polyphenols, is going to increase your antioxidants.
In moderation.
That's in limitation. I would not say moderation, I would say in limitation.
In limitation. And the alcohol beverage that they were promoting yesterday on the sky wasn't wine. I think it was a whiskey. All right.
Yes.
This is not going to work. Thank you, Sveta. We really appreciate that.
Thank you. I'm so delighted to be here and looking forward for more and more those teaching sessions.
We'll do that. Thank you, everybody. And if you want to know more about our summit, go just to healingcancerinthecentury.com. Just for registering, you're going to have 4 free gifts. Distance healing sessions, group healing sessions, 2 ebooks, and you can watch 24 or more trials of our speakers. Bye, everybody.